affected hip.
To keep him
Slow him down. Exactly right. Okay. Ask the patient to look toward the pillow and put his head down on it. So again, he knows where he's going. We're orienting him to where he's at. Okay. Have the patient lie down then by walking his hand toward the pillow. Control the movement by decreasing the amount of pressure you apply on the patient's unaffected hip, and help the patient to lift his affected leg into the bed. Back up 1 second. The prep. You're gonna have the patient cross the unaffected leg over the affected leg at the ankle. Okay, so he's going to take his right leg and cross it over his left. Okay, and I'm going to say that this is going to be dependent on, honestly, I can go either way with this one. If I went over, okay, why would I want to put it in flexion? What might be going on in the lower extremity that I would want to keep it in flexion? The lower extremity, the knee. So your prep is to have him cross over on top of the affected leg. So my right's going over my bad side. Well, I can't really lift in that position, right? But if I have an extension synergy where it's going to put them out here, by simply coming up here, it's going to decrease that tone and keep it in this position. Okay? Now, if they don't have extension synergy and they need help assisting to get that leg up, they cross underneath. Okay? That's going to be how the patient presents as to which way it's going to be better. Okay? But your arm positioning is they're going to cross the unaffected arm in front of the body and support themselves on the bed with the hand, and make sure that the affected arm is in front of the unaffected arm. So when you're prepping, this arm, this right arm, is going to come underneath that left arm so that it helps keep that shoulder forward. So as he's walking down, he's going to be walking underneath that arm, because if he were to place it this way, not a good advantage point. Okay? Alright, so for this one, what do you think? On top or underneath? You want your ankle crossed?
I would think this is...
Okay, we're going to say it's weak. We're going to say he doesn't have any extension synergy. Okay? So again, my hand placement is going to go on the shoulder blade, right? He's going to put his right arm underneath his left. He's going to look down towards the pillow. And I'm going to assist with the ankles. No, I'm going to assist at the hip. Okay, so I can control the descent. I'm going to go ahead and lay down your side. 1, 2, and 3. And then I can come over and help bring the legs up if need be. Okay, he's got them up there, then I just make sure he's positioned. Now if I want to go back into supine, what am I going to do? What do you think? I want him to do this task, right? Okay, so we're going to clasp the hands. Okay, and it's really a good side doing all the work, right? Okay, so I'm going to want to just guide at the left knee, right? Then he's going to roll into his back, and I'm just going to help assist. I shouldn't have to do anything at the upper extremities because he should be able to do all of that. But I may have to help assist with that left leg. And then we'll position him accordingly for whatever we're doing.